Hello again. My name is Raissa Medina Santos. I'm a postdoc at the Laboratoire of Génomique, Bioinformatique et Chimie Moléculaire from the Conservatoire National des Arts et Métiers at Paris, France. And today I will present our latest results, named Transcriptomic analysis uncovering markers of chronic fatigue syndrome post-chikungunya infection. So a little introduction about our subject. We work with the chikungunya virus, which is a vector is the Aedes mosquito. And during 2005 and 6, there is a large epidemic in La Réunion Island, where more or less 40% of the population was infected with this virus. After these epidemics, there is another one who happened in Italy in 2007, and another one in France in 2010, and a huge one in 2013 and 14 in the Americas. So when the patient is infected with the chikungunya virus, he will present few symptoms in the beginning of the infection. So more or less 80% of the patients will present fever, joint pain, muscle pain, rashes, vomiting, nausea, fatigue, and headache. So if the patients keep presenting symptoms after the third month of infection, he will be a chronic phase patient. And in this moment, more or less 50% of the patients will present some of the following symptoms. So the most famous one is the post-chikungunya chronic inflammatory rheumatism, which is very similar to rheumatoid arthritis. And we have also others such as chronic fatigue syndrome-like, which is the subject of this presentation. The patients who present chronic fatigue syndrome have such as orthostatic intolerance, brain fog, fatigue, flu-like symptoms, exercise intolerance, pain, and sleep problems. And the chronic patients of chikungunya can also present musculoskeletal pain, light cerebral disorders, headache, mood disorders, and all those symptoms will be responsible for a deterioration of the health-related quality of the life of the patients. So since we still don't understand why few of the patients will have a chronic phase, and more specifically, why they present symptoms which are very similar to rheumatoid arthritis, for example, and in this presentation, why they present chronic fatigue syndrome. Our objective is to work with a great project named Chicken Gene Project, which is aims to identify the genes and the biological pathways that drive the evolution toward long-lasting manifestation following chikungunya, since it's a major public health issue. So the specific goal of this presentation is to show the comparison, the transcriptome profile of PBMC between chronic fatigue syndromes, so CFS patients, versus only chronic patients, so patients who are also chronic, such as the CFS, but they did not present a CFS. So we aim to identify the molecular signatures of chikungunya symptoms persistence. It's also important to highlight that this is the first omics study ever on long-term symptoms following chikungunya infection, after 12 to 15 years after the infection. So now I will present a little bit our cohort. So for patients who are eligible to RNA-seq, we have 219 patients, which are divided in no chronic, so 86, and chronic patients, 133 patients. Starting from now, we will talk only about those chronic patients, so 133 patients, which I divide in two groups. The chronic fatigue syndrome patients, so 58, versus the only chronic chikungunya who present other type of symptoms, with is 75 patients. So after the CIDR cohort, we have our three groups of methods. The first one is the collection of blood and the PBMC isolation from 2018 to 2020, so that means 12 to 15 years after the infection. After that, we have the extraction of RNA and the sequencing using Illumina HiSeq. And the third part, which is the bioinformatic analysis, where we work with FastQC and MultiQC for the quality, the STAR for the alignment, future counts for the counting, Dissect2 for the analysis of genes differentially expressed, and Metascape for the pathways. So now I will present a little bit our results. So here we have our volcano plot, where we can see the genes who are differentially expressed between chronic fatigue syndrome versus chronic who did not chronic fatigue syndrome. So we can see that we have only three differential expressed genes who are significant, and we are EGR2, EGR1, and FOSB. All of those 3 genes are down expressed in the chronic fatigue syndrome. So they mean that they are upregulated with the chronic, but downregulated with the chronic fatigue syndrome patients. When we check a little bit the bibliography, we see that EGR1 and EGR2, both early growth response genes, seems to be downregulated when related to stress disorders and schizophrenia. And also EGR1 is associated with multiple viral infections, and it's upregulated in the chikungunya infection and in other virus infections. When we also check FOSB gene, which is a gene who belongs to a group of immediate early genes, we can see that he's also downregulated in the brain of both depressed and drug-addicted individuals. In addition, in the infection of SARS-CoV-2, the increase of this gene may indicate a delay in the response to the viral infection. So we can see that all those 3 genes are very well connected to depression, drug addiction, and this type of disturbance. In the beginning, we can think that this cannot be very connected to our phenotype, but it's not correct, since CFS is often misdiagnostic as depression. And individuals with the chronic fatigue syndrome can often have mood and anxiety disorders that more than individuals with other types of disease, such as fibromyalgia or irritable bowel syndrome. So after that, we would like to see if those genes and all the list of the differential expressed genes can show us something else about our phenotype. That's why we check the pathway using Metascape. And you can see in the left, the top level enrichment terms, and in the right, the enrichment analysis using GGenet, which is a database who will present us few diseases that can be connected to this group of genes. And we can see with the top level enrichment terms that we have terms very significantly connected to the immunity. And in the other side, for the GGenet, we can see a huge group of diseases who are very connected, which are phenotypes. So we have depression, mood disorder, mental disorder, headache, and duration of sleep. So in the part of the disease, we seem to be very well connected with our phenotype. But when we check the top level enrichment terms very well connected to the immunology, that raise a few questions that where that immunity can be connected with our disease. So for that, we did the weight correlation network analysis. This type of analysis will allow us to understand the significance of the expression of the genes, even a direction. So for example, here we have a cluster of the genes who are down expressed in the CFS. So we can actually see the direction of the expression of those genes when we check the pathway. So here with this group of genes, we again did the pathway with Metascape, and we can see actually the top level enrichment terms are very well connected to the immunity. So we feel that the expression of the immunity can come from a down expression of those genes in the patients with chronic fatigue syndrome. And when we check a little bit the bibliography, we can see that these studies report the alterations on the immunoglobulin number and distribution in the patients with chronic fatigue syndrome, with a substantial decreasing of IgG1 and IgG3 levels. So we can see that it's very well connected with our patients and what we expect to see them. In the other side, for GGenet, we only found the POEM syndrome, and it's a rare blood disorder that damages body nerves. It's not well connected with a phenotype, but a little information about this disease, that the clinical depression is a common manifestation of POEM syndrome. So in conclusion, this is the first transcriptomic study on chronic symptoms following chikungunya virus infection, so after 12 to 15 years after the infection. The downregulation of EGR1, 2, and FOSB, known for their roles in mental disorders, underscores the potential genetic connections between long-term chikungunya infection and mental health, and to our knowledge, this genetic link has not been previously described. So as perspective to our work, the CHIK gene cohort is a very big cohort. I just present a little part of them. So we have a few other phenotypes we would like to explore. And we also have the Genome Association study, and we will do a correlation with the GWAS with the transcriptomic data. So those two groups of analysis is our main perspectives. So I would like to thank you all for your attention. I would like to thank you, my laboratory, le GBCM, and the collaboration with the Hôpital La Réunion. And of course, for being selected to present my results. Here's my email. If you have any questions, I would like to answer them. So thank you very much.